Dr. Michael Siegel, and here today I'm going to talk to you about fixing a collapsed nasal valve. So let me first go over some anatomy with you. I have Erica here. She's going to be our demonstration subject here. And what we're going to do is this. We're going to teach you about nasal valve collapse. So when Erica takes a deep breath in through her nose, deep breath in. You see this collapse here? That was a good one. So it collapses right here. So everybody has a collapse of their valve if they try hard enough. But what we're looking for is people that have the valve collapse too early on, because the valve is what controls your breathing ultimately. So everybody is controlled with that. So what you'll find is when people have a valve that closes too early, they tend to do this kind of thing where they lift up their nose to breathe better. I'll show you some anatomy in just a second. But the way we test for nasal valve collapse is if someone comes in and they say, I can't breathe through my nose, what we do is take an object here and we lift the upper lateral cartilage up. That's right in here. And we go in here. I'm just going to go touch inside your nose. It might take a little bit. And we lift it up. And if the patient says they're breathing better when we do that, we call that positive caudal maneuver. Okay, so we're looking for people where that's the issue, and then we can fix them with this procedure that we do. All right, so just to show you some anatomy, this is the nasal bone, this is the upper lateral cartilage, this is the lower lateral cartilage, and obviously this is your nostril where you breathe through. What we find is that the nasal valve is created by the upper lateral cartilage in the way it angles with the nasal septum. Okay, so now we're inside the nose. This is the nasal septum, which is the wall that separates the right and left sides. This is the upper lateral cartilage. This is the lower turbinate. And this angle in here is the nasal valve. So in some of our other videos, we discussed the nasal septum and the inferior turbinate. And there's actually a swell body in here as well. A swell body is like a turbinate that's on the septum. And all of those you can see can compromise this angle and compromise the nasal valve. What we're going to be talking about today is a procedure where we can reshape this cartilage here. Using radiofrequency, we can lift this cartilage and stiffen it so that it no longer collapses as easily when air goes through that angle. Obviously, if the nasal septum is deviated or bent to the right side here, you're going to narrow the valve with that, or if the swell body is large, or if the inferior turbinate is large, you can narrow that valve. So the person that we're looking for has compromise of their nasal valve, with the nasal septum being relatively straight, the turbinate and the swell body being relatively normal. Then you're a perfect candidate for fixing this. Now, sometimes there'll be several different abnormalities that we'll fix at the same time. But for now, let's just talk about changing the shape of the upper lateral cartilage. Okay, so what we're talking about now is we're talking about the VivAer procedure, VivAer, and what it does is it uses radiofrequency to reshape the upper lateral cartilage. We do that generally as an office procedure, and what we do is we first put some anesthetic on a piece of cotton in the nose. We leave it sit for a little while, and it makes it anesthetized so that when we inject a little bit of anesthesia, you don't really feel it. Then we take the handpiece for the VivAer, which I don't have one, but I'm going to simulate with this, and we go in and we get in under this cartilage and we lift it out as we cauterize with the radiofrequency generator. We do it in 3 different areas, and one of the more incredible things about this procedure is that most patients will notice a difference in their breathing even after one of the 3 treatments. So it's quite a successful procedure. I've been a big fan of it for a while. There's not a whole lot of complications from it. There's not a lot of pain from it. But you do need to use an ointment in your nose after the procedure, and you have to put it right into that area on the inside twice a day for 6 weeks after the procedure. So that's it for the VivAer procedure.